Dr. Cheryl Jackson is the first medical doctor who has volunteered her professional services in the care and treatment of COVID-19 patients on the island. She's an internal medical specialist who's originally from Tobago. Currently, she works in the United States and has at least 30 years of medical experience. Dr. Jackson was prompted to give back after a family member fell ill due to COVID-19 in December last year. She was further encouraged when the Health Secretary, Dr. Faith B. Israel, made the appeal for volunteers around the same time. Dr. Jackson appreciated the experience of working with local healthcare providers.
I've learned so much from them. I really appreciate the resiliency of the team, for members who put their lives at risk every day, do a thankless job sometimes, or an unrecognized job of going in there, and they do it with such grace, such resiliency, and really encourage me as a provider as to what really matters, which is giving the care. So I do put my hats off, and I'm internally grateful to actually work and supervise the same team of doctors who took care of my family member.
Dr. Jackson volunteered at the COVID-19 facilities for almost 2 weeks in March of this year. During that time, her presence was a much welcomed ease for the doctors who worked at the Scarborough General Hospital as well as at the COVID facilities at Fort King George.
Dr. Jackson's coming is one of the most positive things that has happened for the island of Tobago in the area of the fight for COVID. When you see people leaving their comfort zone and run into danger, you have to respect that. The patients are all doing well. The doctors talk about her teaching. She's very committed. And to hear that someone came and volunteered, she's not even asking to be paid. She wants to do it out of love and what she could do to bring her expertise to Tobago.
She's the first person who has answered the call to come and help. She's come without any salary. We provided some modest accommodation for her. As Dr. Okeke has said, she's a valuable contributor to the COVID fight. She has assisted doctors like Dr. Okeke, who has been at the forefront of this COVID fight for now over 2 years.
Despite the challenges, Dr. Jackson believes that other healthcare professionals can come and engage in medical volunteerism on the island.
I think there's a lot of medical professionals, expats, people who have roots in Trinidad and Tobago. In fact, when I was coming here, people reached out to me directly. How can they contribute? I think there is opportunity for people who are vetted, people who are legitimate, who are sons and daughters of this country, to give them an avenue in which they can come back and contribute with ideas, their skill sets.
Dr. Jackson hopes to give more of her time in the future. In the meanwhile, professionals in the TRHA continue to work out ways in which medical practitioners can either volunteer or work in Tobago. It's all in an effort to provide patients with the best care at our health facilities. I'm Omodara Mills for Let's Talk Tobago.